if Medicare Advantage isn't held, we like complete changes, but we know that that ocean's not going to get boiled. So let's just make some coffee at the moment. Let's just have some metrics that show their denial rates with regard to therapies and how patients are being denied access. At least expose it. I mean, that's what the federal government's supposed to do, right?
Yes, that's what Congress is supposed to do.
To share all of that information.
Our
and when
oversight
it's hidden,
function that's what we're supposed to do.
That's exactly right. And I know this takes forever, but if we don't fight for patients to do this, to get access to it, or to see this, it's never going to end. And so it's really frustrating, and I'll end up going way off track on this. But I need people to support their congressmen and women in moving Senior Timely Access to Care Act, which is bipartisan, by the way, to hold Medicare Advantage plans more accountable to their denial rates and prior authorizations. Because again, if you chose traditional Medicare, you would have gotten access to these therapies. No questions asked. It's not a problem.
But you also need to buy a supplement plan because it only covers 80% of your expenses.
Of course, supplement or secondary, exactly.
And you need to buy a separate drug policy because it does not cover Part D drugs, which Medicare Advantage does.
So that was part of the benefit of Medicare Advantage and why you voted for Medicare Advantage.
Sure, because of the holistic approach. And there's another part of it. Sometimes they do create such narrow networks, so you wonder, what the heck am I doing in here? Mm-hmm. But
fair, yeah.
They are supposed to have a provider for you. You sign up with their plan. One of the problems in Medicare, as you know, the cuts to reimbursement to physicians that have happened year in and year out for years and years mean that some doctors will just not take a new Medicare patient. And so if you're even, on traditional Medicare, if you pick up the phone and call a medical office and they say, who's your insurance? And you say Medicare, I'm sorry, we don't take any more Medicare patients. That happens all the time. So one of the advantages to Medicare
Advantage. I did that, by the way. I called a provider just to see if I get an appointment. I was just testing your theory. We had talked about this a long time ago. So I called and said, I'd be a new patient. What insurance do you have? I said Medicare. And they said, we're not taking new Medicare. Call back later. I was hoping to get somebody else on the phone, which I did. And I said, I have Blue Cross. And they said, oh, yeah, we can see you next week. And I'm like, there it is. There it is. I mean, just try it. And it happens every single time.
So God you didn't believe me?
You had Medicaid.
You didn't believe me? And
trust but verify, Michael. Trust but verify. But imagine even for Medicaid. Right? I mean, that would be 10 times worse.
10 times worse because the reimbursement rates for Medicaid are set at the state level. And every time the state gets into a budget crunch, they cut Medicaid reimbursements. It's one of the first things that happens in Texas every 2 years when a budget's constructed. They ought to protect that a little bit better, but they don't. And this was why I could never be upset with Governor Perry when he wouldn't expand Medicaid because nobody, no doctor takes it willingly anyway. You've got to be literally on emergency call, and now you get assigned a Medicaid patient. I mean, that's literally how it happens.
Mm-hmm.